Well, let's turn attention now to health. Here in Lagos State, the Health District 3, through its integrated medical outreach program, recently provided a wide range of healthcare services to residents of some local government areas, ranging from general health checkups, blood pressure and sugar level screening, eye examinations with free prescription glasses, among others. This intervention, according to officials, shows the commitment of Lagos State government to primary health care of residents. Communities were urged to take serious advantage of the opportunity of the free Medicare and essential medical services brought to the grassroots. Well, let's expand on this further, as health is a big conversation around the world today, with AIDS being caught by a lot of donor organizations, as states are having to fill in. The Permanent Secretary Health District 3, Monsurat Adeleke, joins me on the news for more on this development. Good to have you join us, Monsurat Adeleke.
Good evening. Thank you for having me.
So a lot of, I mean, I know you've been following the story. That's your field, where we find that the global funding for AIDS, especially in terms of health, has been reducing, and we're finding that governments around the world are trying to fill in. Talk to us about the purpose of this particular healthcare delivery by the Lagos State government, and then the impact that it had.
So basically, you know that we always say Lagos State is the center of excellence. We try to key into global best practices. So Mr. Governor is the first in Nigeria that looked towards all of this, especially in terms of sustainability. He decided to appoint 6 permanent secretaries for the 6 districts in Lagos State. He mirrored the education districts. What he was trying to achieve is that we know that the bedrock for the health system is the primary health system, the care system. So he decided that if he appointed 6 permanent secretaries to head all of these 6 ones, he mandated us that we should carry out healthy rivalry amongst ourselves in a bid to bring the health system closer to the citizenry. So what this is about is that I coordinate 3 local governments, which is Etiosa, Ibeju-Lekki, and Ekpe. So basically what he has charged all of us to do is that we go out there. The government cannot do it alone. You've just said it, that dwindling funds and all of that. So we've now intensified our domestic resource mobilization. Lagos State, we have a full assortment of the private sector. We also have the traditional rulers. We also have the religious leaders. We have so many people to tap into. So what we've gone out there to do is that we've now partnered with so many of them, and you'll be surprised at how much progress we have made from the 2023 that he appointed us to now. Our indices have gone up because we've now focused on infrastructure development. They don't give us money. We just partner with these people. We have people from the Federal House of Representatives. I have Honorable Wale Raji. He did an upgrade of Iraye PHC in Ekpe. We fully put in staff. It's fully functional. We have people like the chairman of Ibeju-Lekki, Olowa. He too has upgraded so many facilities, and we've put staff. I
like that. It looks like, in doing that, first of all, splitting the local governments into 3 each for everybody.
Some have 4.
I mean, just breaking it down into smaller units, you're able to pay attention to the grassroots. Yeah. And then it looks like the governor was also forward thinking, because now the aids have been caught, so you have to source for the funds yourself. But I also just wanted to ask, in terms of the primary health care, which is, this is a one-time event, but what about the primary health care delivery to the people? I mean, you're covering 3 local governments.
So that's what I'm saying. By the time we start first with infrastructural development, some people have supported me, so T.Y. Danjuma Foundation, solar panel borehole to have potable water. Imagine all those other people that are upgrading. We're having 24 hours lights. And we have a mandatory compulsory health insurance in Lagos State, where we're going to reduce the out-of-pocket expenditure. So by the time all this infrastructural development is taking place, we empanel them in Ilera Eco, so we can even get more indigent people to now be able to get all our service delivery for free. We also continue and we do monitoring, go in there to improve the quality that our staff are providing. Now, because of all of these things that we've put together, we've increased patronage in our facilities because we have a poor health seeking behavior in Lagos. But because they now know that all these services are available and the spirit of JAPA, a critical shortage of personnel, we're doing task shifting, task sharing. So everywhere we see the upgrades are going on, we move in. And then again, because of Mr. President, what he did about the autonomy for the chairman have been empowered, and most of them are channeling efforts in upgrading and improving services in all of these places. So like even recently, the outgoing chairman of Ikoyi-Obalinde, which is still part of my own thing, he gave us an edifice in Ikoyi-Obalinde, Senator Oloremi Tinubu PHC, and immediately we put in personnel. Yesterday, I went there to monitor, to see all the low-hanging fruit. So it has really helped us. We have a like 14% increase in antenatal care. Unlike before, they'll come for antenatal care, and then postnatal, they'll go to traditional birth attendants. Now we've had 13% increase. We had 100% in our supplemental immunization campaigns. We go to riverine areas and do school health programs.
It's a lot that you're doing. TVC is very, very, very grassroots. We'll continue to follow all of these developments at the grassroots level. I'm sure we'll have this conversation with you over and over again. Thank you so much for your time. Permanent Secretary, Health District 3, Monsurat Adeleke.
Thank you for having me.
Thank you.